What is trauma?
This is a fascinating conversation. We could have a whole hour on this. So I mentioned before, people previously thought that trauma was only something that combat veterans could experience. And we actually had a word for it. Back after World War I, it was shell shock. People were noticing like, oh, our soldiers are coming back different. And there were symptoms associated with shell shock. And then there was some research and funding put into understanding that. And then some very astute mental health professionals realized that people who had been sexually assaulted were showing the same symptoms. And then they started looking more and more broadly. And pretty much since Vietnam, we have been understanding that trauma is so much more pervasive and complex than we previously understood. And yes, there are specific acute traumas that only people that have been in natural disasters or in an active combat zone experience. But psychological reactions that people have to less life-threatening situations can be very similar. I would say that trauma is anything that has a pronounced negative impact on your view of yourself or the world and produces symptoms that make life more difficult.
So we often hear these days that trauma is not what happened to you, but what happened in you as a result of what happened to you. Is that what you're saying?
Absolutely. People can be at the same table having the same conversation and be having a very different understanding and experience of that conversation. And when you apply that to something traumatic, it makes a lot of sense that people have a lot of different responses and a lot of different ways that the brain categorizes and makes sense of it.